Okay, we're going to continue with the gastrointestinal system of the fetal development. So this begins forming about week 4. So stool is accumulated within the intestines of the developing baby and then is excreted when they're close to full term. The stool that is accumulated is called meconium, and at this point it is sterile. There are no bacteria, there's no viruses, or there shouldn't be with this, and that's the stuff that we get really concerned. If we have amniotic stained or meconium stained amniotic fluid that baby has passed on the stool while in utero, that is usually a sign of stress. And then also that sticky tarry stuff can get in their lungs that way too. Metabolic rate is relatively slow concerning the development and creation of brown fat. Remember I talked about brown fat is that it's a fat that babies are born with. They use it in times of stress, and once it's gone, it's gone. It's a really good source of energy. The gastrointestinal system is usually matured by about 36 weeks gestation. Okay, fetal neurologic system begins developing around week 3. By week 8, there's many brain structures and eyes are developed. The 11th and 12th week, peripheral nerve structures allows for movement. There is a sensory awareness, so babies can start responding to sound about 24 weeks gestation, can taste around 5 months gestation. Cold spots in the amniotic fluid can cause them to have hiccups. And we can see at 7 months gestation that they're starting to have REM cycles in their sleep. All right, reproductive development. So differentiation between male and female starts around week 7, and by week 12 they are distinguishable. So Y chromosome, if that is present, coming from the dad, right? Scrotum and testes will develop and testosterone hormone increases. If the dad has given an X, then baby will have 2 X chromosomes leading into a female, so ovaries and other female genitalia will start to develop. By the 16th week, oogenesis has established, and at birth, the ovaries will contain all the ova for a lifetime. So females are born with the maximum amount of eggs that they will ever have. Pseudomenstruation and mammary gland development can happen. It's just due to the burst of hormones babies get during labor and delivery, and then that withdrawal of those hormones causes this. And this can be seen with both male and female babies. So we expect, to see a little buds in their nipples and some blood in the diaper, just a little bit. Multifetal pregnancies. So twins are 1 in 43 pregnancies. You have dizygotic twins and monozygotic twins. And so the difference between these is with the dizygotic twins, you have 2 eggs that were released and fertilized, versus the mono, where it is 1 fertilized egg that has split into 2 fetuses. So that's the difference between those two. There's different risks, different categories, different things that can lead into these different types of pregnancies and different complications as well. Here's kind of a picture of it too. So I have a cousin that was actually pregnant with triplets, and she had 2 eggs that were released, and actually one of those eggs had split into 2 babies, so that's how she got 3. So there was a set of identical twins and then just another baby. Anyway, complications during pregnancy is our next section here. So here's a table to explore some biophysical factors, psychosocial factors, socioeconomic factors, and environmental factors that can lead to high-risk pregnancy issues. There's genetic considerations, nutritional status, medical and obstetric disorders, smoking, caffeine, alcohol, drugs, psychological status goes into that, low income, lack of prenatal care, age, adolescence, mature mothers, parity, meaning having multiple pregnancies, marital status, residence, and ethnicity, and then environmental factors, infection, radiation, chemicals, therapeutic drugs, illicit drugs, industrial pollutants, cigarette smoke, stress, and diet. I was just talking to my husband. I remember when, in the 90s, when I was a kid, every time you went to a restaurant, it was like, would you like the smoking or the non-smoking? And, like my family didn't smoke, so we were always the non-smoking, but it was like right next to the table that did have smoking, and how funny that was, like acceptable back then, to be far enough away from the smoking pollutants. All right, discuss psychological considerations associated with a high-risk pregnancy. So there's different things that we look at with high-risk pregnancies. We can have issues with anxiety, just that overwhelming worrying about things that you may not have control of. That's where it starts invading your thoughts, your daily life, things like that. Having low self-esteem, feeling like inadequate to be a good mother, things like that. Guilt, maybe they feel like they shouldn't be bringing a baby in, or they feel guilty that their baby is less than perfect, or maybe they did some, like drank or had a sip of alcohol or something, and now there's a not consequence, but now maybe baby is showing signs of something else happening. So the mom might have some guilt over, I had that one sip of alcohol, now I've ruined my baby's life, or something like that. Frustration. So when I don't know, there's this like kind of Disney look at pregnancy for some reason, that babies just make it all better because they're super cute and fun, but actually what comes with it is a lot more stress. Bodies are changing, relationships are changing. I have a really close personal friend that, when she became pregnant, her husband just like quit being involved in her life. He had this major like psychological meltdown where he didn't want to be a dad. He didn't want to be a husband. He was a completely different person than the person she had married. And, things like that happen. The inability to function, taking care of themselves, getting an adequate nutrition, hygiene, all those things. Creating vulnerability, especially with pregnancy. We tend to look at the health and well-being of both mom and baby. And sometimes that takes sacrifice on the mom's end and others' end too, especially if they get put on bed rest. If it's a working mom, can she still keep her job if she's placed on bed rest? And then, maybe she's got other children to take care of. So there's a lot of weight on her shoulders in terms of that. And then family needs support to regain control of the situation. So, maybe they just need some extra resources to help them, whether it's finding food, finding daycare, finding transportation, finding healthcare, things like that. Differentiate among screening and diagnostic tests. So we have screenings where lots of moms are going to go in, have these screenings done, and these are meant to try to pick up on potential problems that could be going on. It doesn't confirm whether a problem is going on or not. It just leads us into that we need to do more investigation. So we look at different risk factors and things like that. Diagnostic techniques confirm complications or problems. So if we have this screening and the screening is positive, then that means we need to do further investigation. And that could be in the form of a diagnostic test that will tell us, yes, they have it. No, they do not have it. And then if they do, what are the extent of complications or problems? Okay, one of those is a biophysical assessment. So there are several things that go into a biophysical assessment. There's the daily fetal movement count. So we call it a kick count. We aim for 10 movements 2 to 3 times a day. If mom feels no movement for 12 hours, it is considered an emergency that something is going on with baby. In ultrasound, we usually do a it should be trimester. I should change that. First trimester is a 2D, which shows most views that are needed just to assess for baby's overall health. A 3D shows some diagnostic, but mostly just enjoyment for parents to be. It kind of gives shape to the baby. And then 4D is when you have shape and movement added to baby. Ultrasound diagnostic test, fetal heart rate activity. We look at what the baby's heart's doing, the pattern, things like that. Gestational age, making sure that baby is still matching what they should be for gestational age. If baby starts measuring bigger than what we estimate, then maybe we think that baby's further along than what we thought. LMP is just a really good guess. It's usually really accurate, but it could be off too, depending on the situation. Or if baby's starting to measure smaller than what we anticipate, then we could look at potentially things that might be happening in the pregnancy, some complications, some health concerns. looking at rate of fetal growth, kind of with the same thing, fetal anatomy, making sure the heart is shaped appropriately, has all the chambers, and they're all functioning the way they're supposed to be. There could be some genetic disorders, physical anomalies, placental position. So we look at where that placenta is positioned, with the placenta previa or abruption or things like that. So we want to keep tabs on that. We look at fetal well-being, looking at a Doppler flow analysis, just making sure the blood is flowing the way it's supposed to be at the volume it's supposed to be, looking at amniotic fluid volume, and a biophysical profile, which is, it takes a lot of things into consideration. Again, like if baby's practicing breathing, things like that, how many kicks they're doing, and a lot of measurements, as well as looking at mom and seeing if like the cervix is starting to dilate and things like that. An MRI can be done for potential complications. MRIs are very safe for pregnancy. There's no radiation, but because MRIs require the baby to be still, it sometimes is not the most reliable form, because if baby moves, then the images are going to be distorted. So it's an extremely hard test to do. And then the mom must be in a supine position, which we know can put pressure on that inferior vena cava. So there's other types of assessments that we can do to make sure baby is developing appropriately and having, or if there's any genetic concerns or things like that. And amniocentesis is one test that we can do. It's when we take a sample of the amniotic fluid. And, there's a lot of risk involved with a lot of these tests, because we have to put a needle through mom's abdomen. And, we hope that it's not going to like pierce the baby kind of thing. A specialist would have to do this. We do this test, especially if there's genetic concerns, looking at fetal maturity or any kind of a fetal hemolytic disease. Chorionic villus sampling is another test that can be done. It's for accuracy, it's about the same as an amniocentesis. Should be done around weeks 10 and 13. Limb loss is reduced. So, like I said, a needle's got to be placed within the abdomen, within, the uterus. And so, we really hope that we're not nicking something that's important when doing these tests. So it's best to wait till after 9 weeks for sure. And then there's different blood screenings that can be done from the mom's blood as well. Alpha fetoprotein, multiple marker screens. Those tests, usually there's kind of some kind of a range to them that, if it scores higher, then they're at risk for this. If it scores lower, then they're at risk for this. Accuracy is kind of all over the board when it comes to these tests. And there's no guarantee. So if you get a really high score on something, there's no guarantee that your baby will develop whatever abnormality that they're suggesting might be having. I know a lot of moms that have had these tests and been told, your baby's going to have Down syndrome, and babies are born perfectly healthy. So, but it is something that the mom should have a choice of having done. So a Coombs test, an indirect Coombs test, I believe I've already talked about. So these look for that RH incompatibility. So an RH factor, that's, when we look at blood types, that's that positive or that negative blood type. And so if mom has a negative blood type and baby has a positive blood type, that's when we get concerned that there might be some incompatibility happening with baby. All right, I'm going to stop there and record on with another video.